Hey everybody, today I'm addressing the smoking cessation discussion board. So I think it's most important to maintain a neutral and non-judgmental health promotional stance when approaching this conversation. Patients who feel belittled are not going to be receptive to anything that you're saying. So I also think it's important that the patient understands that she's capable and that she's going to be encouraged, and this is not an impossible task, that she can do it, and also that she's not alone and she's going to be supported along the way. It would also be helpful for the patient to explore barriers of why she may not be successful in quitting smoking, so help her discover what those barriers are, and then addressing those. When approaching smoking cessation with a patient, the Agency for Healthcare Research and Quality recommends the 5 A's behavioral framework, and that's ask, advise, assess, assist, and arrange. So that would be the method that I would use to address this with her. And we know that counseling sessions of less than 10 minutes combined with pharmacotherapy assistance significantly increase that success of cessation. So she may need the combination of both. So first I would ask her, how often she uses tobacco, what she's using, how much, and then I would strongly urge her to quit and let her know that it's affecting her health, kind of go over, some of her health issues and how that can be affected by smoking. And I would also build on the scenario that was given by the patient of her coworker who has lung cancer, and kind of help to use that as motivation for her and relate that to the health issues that occur because of smoking. And then I would assess. So I would assess that the patient is truly ready to abstain from nicotine, make sure that this is really what she wants. And then if she's on board, then I would begin to assist the patient. So I would start using counseling and the pharmacotherapy to help her quit. So I would help the patient create a plan to limiting cigarette use, or a method of weaning the amount of cigarettes that she's using. And then at the end of a determined weaning period, I would also help her develop a plan so that she can eliminate things in her surroundings that remind her of smoking, that smell like smoking. So, getting rid of ashtrays and lighters, and helping her to know that it's a good idea to wash curtains and those sorts of things, to get rid of the smell. Due to her level of addiction, this patient is likely experiencing, she'll experience nicotine withdrawal, and she is probably pretty addicted to nicotine, and so she might need to be offered some pharmacologic options potentially to help her stop smoking and be successful. So she could start with some over-the-counter stuff like nicotine gum. She could do a nicotine patch. We could always prescribe something, do nasal sprays, inhalers, or she could be offered prescription medications such as Bupropion or Varenicline. I'm not really sure how to pronounce it. Those are the 2 that our book mentioned. So she could use either one of those, and the Varenicline, that it stated in our book that was effective alone. And it said that it was pretty effective as well. So then the last step is that we need to arrange something for the patient. So she needs to have follow-up and support so that she can be successful, because if we just send these patients on their way, they're not going to, they are probably not going to be successful if you just kind of throw them out into the world and good luck, hope you quit smoking. That's not going to work. So we would need to schedule a follow-up appointment with her, within a week, to determine her progress and see how things are going, to help continue to encourage her. And it's going to be imperative that this patient has that follow-up and support throughout the entire quitting process. So we're going to need to be seeing this patient throughout that process, and she may even benefit from a support group. And it's going to be helpful also, I think, to manage her depression and make sure that that is controlled, to aid in reducing, maybe some self-medicating type, coping mechanisms that she's using with cigarettes, maybe for that. And of course, we want to make sure that we're co-managing make sure all of those health issues with the hypertension, the diabetes, all that stuff is managed as well appropriately. So yeah, any questions, let me know. Thanks, guys.